Okay, welcome everyone to the Utilization Review and Prior Authorization with Agentic AI event. Very excited to have you all. So I think today, my name is Gabriel Skelton. We'll do some intros in a second, but today's a very important topic. And aside from technology and efficiency and optimize, it's all great and bottom line. But I think a lot of us in the United States have loved ones with serious healthcare needs that have experienced delays, have experienced care that they actually need. And a lot of that has been due to overall healthcare admin inefficiencies, bottlenecks in prior authorization and utilization review in this whole process. So it really matters aside from just trying to help the process, but an individual patient need. And all of us are patients at some point in our lives. So that's really important. So we've all seen the stats. I think nearly 1 in 5 care delays are specifically tied to prior authorization breakdowns. Over 80% of denials are avoidable. And again, denials are not just about bottom line. Denials affect people's lives. And a lot of it is largely due to these inefficiencies within utilization review and prior auth. Right now, today, doing it manually, it takes 16 minutes to manually process a single prior authorization. So there's countless stats of what's going on here and the disdain that physicians have towards needing to do this process. No way around it today. But in what we're talking about today, there's like, who is it affecting? It's affecting basically every healthcare provider, but healthcare providers that have a little bit more complexity for what they do, whether it's specialty care like oncology, cardiology, orthopedics, behavioral health, but also folks that have to deal with a lot of concurrent utilization review and prospective review, have to deal with it a lot because they have to deal with a lot of inpatient stays and having to consistently update prior auth and get more and more prior auth to cover the days that patient may need to be admitted. So it's a huge thing because of expired authorizations, documentation gaps, all the portals that need to be used, right? The payers don't talk to each other. So that's kind of what we're talking about today. So let's start with some actual intros. So let's start with Zia Buddha. So Zia is the CEO of OpenBots. He's a serial entrepreneur, an investor, and has had a very big vision of autonomous revenue cycle management over the last half decade. Zia, if you don't mind, say a few words and happy to have you.
Good afternoon, good morning. Thank you, Gabe, for the introduction. It's great to be here. Healthcare obviously is a very interesting space that affects us all. And some of the problems that we are working on are the core problems within the healthcare, which affects pretty much all of us. So for us, this is not just a business. This is a mission, and our mission is to improve the quality of healthcare and the speed at which healthcare and the quality, the overall quality of a patient provider interaction. So that's kind of like our driving force behind this. So very excited to be here.
Happy to have you. And next is Rano Banerjee. I never call you by your full name, Rano. It's funny, yeah. But he's the associate director of healthcare automation. Rano's been responsible for a lot of happy clients. All of our clients know Rano, and it's really important because he's the one that bridges the gap between, hey, we're facing this huge challenge as a healthcare provider with payment posting or with all these denials or all of this slowdown in care. And Ronald's able to bridge that gap to say, well, I understand the technology side, I understand the healthcare operation side, and here's what you need with automation to help you. So Ronald, thank you for joining. And if you don't mind, say some words.
No, absolutely, Gabe. Nice to be here with you and Zia. Always a pleasure speaking on this kind of panels and webinars. Yeah, my name is Rano. I'm the Associate Director of Healthcare Automation Solutions at OpenBots. And like Zia said, like we are just not a AI platform provider who is looking to automate the revenue cycle operations for health systems and bring in efficiencies. It's a mission for us. We want to ensure that providers are happy, of course, health plans are happy, and at the end of the day, most importantly, patients are happy. So yeah, we are looking forward towards this mission.
Thanks for coming, Ronald. So, Zia, let's actually start right away with prior authorization specifically. At a big picture, tell us a little more about the entire revenue cycle, other admin challenges, like what other admin challenges are providers facing across healthcare, and how does it differentiate with prior authorization?
So yeah, so prior authorization is different because it's front-ending process. So with prior authorization, that this is how the payers manage and throttle patient care, and it's, if not done right, it delays and even denies patient care. So this is highly sensitive. You're also dealing with different types of payer rules, and to deal with that, you have to pull in physician and nurses into some of this non-clinical work that is required in the front end. So, unlike billing and coding and, things like claims and those type of things, which are mostly handled by the administrative staff, the prior authorization, it's a front-ending process, and it can pull in the people, and, it can pull in the clinicians, and at the time when they should be focused on the patient. So that's why it's different. It's a lot of it is real time. It's peer driven. It's unpredictable, and it's a daily bottleneck that can disrupt the clinical workflow and the patient access. So I think this combination of immediate impact, variability in pay rules, and overall ethical weight sets it apart from all the other administrative hurdles.
Excellent answer. I love that, especially because it's one of the reasons why it's one of the biggest problems, because it's right in the front end, but it's really kind of like the middle. Like if you don't get that right, it affects everything much worse when you go downstream. So, Rano, talking about that, I mean, you're working with our healthcare providers every day, every week on utilization review and prior authorization. Can you paint a picture of what staff actually face day to day when handling prior authorizations?
Yeah, absolutely. Yeah, prior authorization is turning out to be a real grind for providers. It's a process which is not just time sensitive, but the fact that prior authorization, in a way, is also tied to the bottom line. In a sense, it affects the company's financial health. It's a very, very sensitive process at the end of the day. Now, we do work with providers who often have a request that, here we have a utilization review process, and we have thousands of patients. Our prior authorization team is having 7 FTEs. Why don't you offer us a solution so that we don't have the need to hire 5 more people just to go for the utilization review or look through the medical necessities of every single patient for every single health plan? Well, some of the things that we have seen is that there's a lot of documentation and paperwork that is required for every single person on the prior auth team. Meaning, you go into the EMR, you review the health plan, you review the medical records of the patient, you review the medical necessities. That's like one part of the work you are doing on the EMR. But if you think on the other side, there are quite a few thousands of health plans that is available in the United States. Every single patient will have a unique plan on its own. So it's the duty of the prior authorization team members to go into the individual peer portals, submit all the documentation work, which is essentially the patient name, patient's demographics, retrieve the provider's information with the provider's NPI, give all those procedure codes and diagnosis codes on top of the Availity or the United Healthcare or the Cigna or any other peer portal, and then come to a point where you get to realize whether even prior authorization is required or not. So, in order to even determine whether prior authorization is required, you have to do so many steps. And that kinds of aligns with the statistic that American Medical Association has came up with. American Medical Association said that an average practice typically gets something like 39 prior auth requests per week. Simply translate that into hours, it's going to be 16 hours or 2 full work days of labor. Now, the point that I'm trying to make is that it's a very time sensitive process. It's a process where you need to constantly review the documents, constantly review the medical necessities of the health plan. The other interesting side of the story is that the health plans are constantly getting updated. So a service which was once covered in a health plan in last quarter might not guarantee to be covered in that same health plan for this quarter. So you always have to stay updated with the different health plans and different guidelines. And there comes the opportunity where you can use agentic AI, you can use any other digital technology just to mimic the actions which a prior authorization specialist is performing on the health system side.
I love that. And the AMA also said that 33% of patients abandon treatment specifically because of authorization delays. And it's actually very difficult to find consistent statistics around prior auth, depending on where you look, because it's
Right.
hard to manage. Right now, people are just surviving. It's very difficult to even track things when you're just trying to survive and get things going. What we do know is that at a minimum, 37% of denials are directly attributed at a minimum to eligibility, prior auth, and registration right at the front end. The point is that manually sifting through changing payer rules, manually sifting through every single clinical note, manually going through the patient history. And look, if you're a utilization review nurse, you have clinical knowledge. You have so much on your plate. You need help. Automation is the only way to do that in a very practical, quick, accurate way as things are constantly changing. So let's move on to the next question, Rano, which goes hand in hand with this. If you don't mind, walk us through. We always talk about AI agent, right? And it's gotten to the point people actually even don't believe in it because like, oh, this is fluff, but it's a real thing and it's real technology. When done correctly in a verticalized specific area within healthcare, you can have a lot of value. So if you don't mind, walk us through how an AI agent actually handles a prior auth. Once medical necessity is deemed and you're going that route, tell us a little more of how that works. And specifically, if something doesn't go smoothly, what happens?
Great question. Two sides of the story. AI agents have both the components. Some of the components is kind of derived from the days of automation where you can bring in the rules, you can grab the data from certain places and kind of stitch the workflow. There's one component on that side. What's interesting to your question is that what can AI agent do which these automation bots couldn't do? And that's where AI agents comes in, which are kind of termed as decision maker agents. So let's talk about a happy path. In a happy path, you are essentially looking at an AI agent that goes into a EMR. For a patient's insurance eligibility, it can verify who the primary and secondary insurance payer is from the EMR. It can then go into a payer portal. Even before performing prior authorization, it can run the eligibility check for a patient by putting the patient's member ID and date of birth and get to see whether the patient has the right health plan and right coverage for that particular insurance or not. Now, thinking about the authorization submission piece, it's too much for a human to keep filling all those data like the patient's demographics, the patient's ICD codes and procedure codes on a portal, finding the NPI of a provider, like I said, doing all these things one after the other to come to a point to see whether prior authorization is even required or not for the medication or service for that particular health plan. For an AI agent, it's a matter of few minutes, if not seconds, to perform this work. So on a happy path forward, if you think about a health system who has to perform a prior auth in the next 4 days, 100% rely on AI agents to do that. I will tell you where AI agent is going to come into play, where you have to take an immediate decision. Think about this for a second. You have a patient in front of you, and that patient is requesting you for a CT scan, and you need to do the CT scans prior auth in the next 20 minutes. Where can an AI agent help? An AI agent can immediately go into the patient's record within the EMR. It can pull out the patient's medical necessity documents. It can pull out the patient's medical records. It can create a package and then send that package to the prior auth specialist on the health system side for them to have a review. Based on our discussions with the business owners from different health systems and different provider groups, we have always seen that, the business owners are interested in agentic AI, but they just don't want to rock the boat by doing everything with AI. They want to take a step by step approach. They want AI to consolidate all the documents that is going to be submitted to the peer portal by the AI agent. And at the same time, they want the human to take the control of the phone call and have the clinical conversation done with the person on the insurance side. So in a way, the AI agent is assisting the human to kind of complete the whole prior authorization process, if that makes sense.
No, absolutely. I think you summed it up very well, and I think what you're mentioning is, for example, like this role. For example, think of a utilization review nurse. They're essentially like a denial prevention specialist. Like they're highly trained, they're well compensated, and they're focused on protecting the revenue of a provider, right? But they cannot do it alone, given the sheer volume of prior auths, and we mentioned payer rules, and every missed reauthorization or documentation gap again affects revenue. It affects your cost to collect overall, and that's not good. So if you think of a specific example, like think of like a large treatment center, right, that's dealing with patients that are staying overnight. You not only have to do it in the front piece of it, and actually with the prospective review, you have to deal with it every single day, basically, to make sure that you can keep getting prior auth over and over and over again. So that's another piece that technology can help with significantly here. So
Yeah,
Zia,
and if I make one more point here, you know, we think about all types of cares, right? If you think about urgent care and immediate care space, that's the concept where you have on-day scheduling. You won't have 3 days or 6 days in advance to do prior authorization.
mhm.
And one of the concerns we have seen with urgent care groups is that here we have a lot of demands from patients to kind of have the scheduling on the same day. Our clinic starts at 7 a.m. in the morning and it kind of closes at 11 p.m. in the evening. But our business hours for the prior auth team is between 8 a.m. in the morning to 5 p.m. in the evening. So literally all the authorizations that is getting submitted from 5 p.m. to 11 p.m. is stacking up. But the worrisome piece is this: for urgent care, what they call as a retro authorization, you need to submit the prior auth within 24 hours. And you know the result of not submitting the prior auth within 24 hours. That claim that you submit after 24 hours is going to be counted as a denial. So it's not only the time sensitivity part of it, it's also the revenue loss part of it, which is accountable here. So I just wanted to make that point on why these concept of AI agents is constantly increasing to add the scalability factor with the prior authorization team members.
Well said. I think it makes sense because what's changed now with the revolution of the generative AI, agentic AI, is that before, when it comes to clinical knowledge, you couldn't really automate that at all. But now that that's changed, like when you can actually have an individual who's not just sifting through the paperwork, is focused on the patient, can manage a lot more, can look at things from a more of a macro view versus just surviving, it completely changes the way you operate your org, and it can help things like cost to collect and your denial rate and your first pass approval rate, metrics that you either need to be tracking, and if you are tracking, you need to be laser focused on improving it, not just time savings. Time savings is great. That's more of an immediate impact, but your long-term impact completely changes how you operate as a healthcare provider versus an incumbent or versus your competitor, and how you deliver care to your patients. So Zia, turning it to you, if you don't mind, help us almost like from like a CEO, CFO perspective. How do you measure ROI here? What are more kind of how you can actually measure labor savings or denial prevention or revenue acceleration? I'd love to hear from you.
Yeah, so I think for most CFOs in healthcare, denial prevention is the top ROI driver, right? Because every prevented denial directly protects the revenue that would otherwise be written off, right? So some of these, the labor savings, some of the automations do matter, right? But they're usually viewed as an incremental cost reduction compared to the much, larger financial impact of avoided denials. So denials is a big driver for CFOs. Revenue acceleration, faster prior auth approvals lead to more completed procedures, and accelerates revenue. So revenue acceleration is compelling, but it can be harder to measure sometimes if you want to quantify it. The CFOs, they like to see a full ROI story that includes labor savings and throughput gains. I think the reduction in denials is still on the top of their list, and a lot of the reduction in denials is directly linked to the prior authorization and the prior authorization process, right? So I think those kind of there is this statistic that you can have 1% of the denials can actually have almost 20% of impact on your margin. So those are things that a CFO would care about. So yes, I mean the denial would be the number one thing that they would care about, but then they would also care about the reasons for those denials, which in many cases can be traced back to the prior authorizations, can be traced back to the coding and the claim submission process. So all of that above, but denials is really is the driver for a CFO.
Absolutely. We always hear about the fight. And by the fight, I mean the fight that payers are doing with AI against healthcare providers. And they started actually earlier. They had a little early adopter mentality there, and they had the advantage in a way. But there's been a huge momentum with healthcare providers leveraging AI to fight back in a way that is really geared around the patient. It's not so far too much as a bad guy here. Both parties had their own goals, but the point is that we need to make sure we have the patient in mind at all times. With that being said, we've talked a lot already today, Zia and Rano, about how big of a bottleneck prior auth is, how automation can help with it. If you don't mind, Zia, I mean, what do you feel like within patient intake, within the back end of the revenue cycle, within even the patient provider interaction, what's the next domino to fall? Like, what do you see a lot with the healthcare providers having the most success that automate prior auth, and what else? Like, tell us a little more, like, what are the other areas that are super critical for a healthcare provider to automate to get the denials down, to get the time saved and all that?
Yeah, so if we look at, again, I think the everything is a priority, but if you can streamline prior authorization and some of the other front-ending processes, right, like referrals and intake and those type of things, I think the next focus area is the middle and the back office. So claim submissions and denials management, right? Again, assuming that you have cleaner and faster, prior authorization, and that is alone, it's the biggest source of rejections for the claim. So if that is if you have solved that problem to a large extent, you're not going to solve it 100%, but if you have solved that problem to a larger extent, then I think the next focus is on improving the claim accuracy. When you're submitting the claims, there's a lot that goes into a claim. You have to look at the patient chart. You have to analyze the documents. You have to look at the payer rules and all the supporting documentation that a claim needs to have for a successful outcome, right? Because without that successful outcome in a claim submission, your cash flow will be impacted. So we think so. I think it's the claims and denials are the next domino that you want to focus on. But then you also have efficiencies in the real back end payment posting. We see things like receivables and payment posting and those type of things. There's a lot of manual work. We see not only some of the providers doing that work themselves, but we also see some of the providers using some of the offshore companies to do that work, with utilizing cheap labor, which is great. But we think that if you can bring a lot of that work under your own control by using AI automation, and accelerate the process even further, and also increase the accuracy of the process. So it's claims, it's denials, it's a back-end processes like payment processing, receivables and those type of things, and all of them have impact in your overall stability of the business.
I love your point around control. And when it comes to the whole kind of getting it from one set of human hands to manually executing a process in a cheaper set of human hands, it does help you, right? It does lower costs, but it doesn't always solve the problem. You're not attacking the root cause, and you're actually losing control of the process. The last couple of years has been a huge shift, and Ron, you can comment on this afterwards if you want. It's been a huge shift where healthcare providers are realizing, especially in an area like prior auth, that speed matters so much and turnaround time matters. They want to keep it close to their heart and they want to keep it close to home, because when you have more control, the issue is that you can't really do it if it's fully manually because it's not cost effective. However, if it's fully manually for the pieces that need to be manual and you layer in automation technology where it needs to be, that's the approach that every healthcare provider, no matter the size, is looking to get to, because automation does not need to be perfect. It just needs to be better. So then to Zia's point, then you layer that in to, okay, where else are the denials on payment posting? Let's look at that EOB. Let's look at the reasons for denial. Let's have the AI agent understand those reasons and resolve that iteratively. And it's a nonstop process to attack and attack and attack and attack all of the potential reasons for denials and all of those manual errors when it comes to coding, all of those manual errors when it comes to eligibility, all of the manual errors when it comes to prior auth is a thing of the past. There still will be errors, but at a much lower clip because the process is streamlined and streamlined and streamlined over and over again. So Ronald, you want to comment on that a little bit of what we've seen with our clients?
Yeah, no, I think Zia used the word control very wisely, very prudently. It's funny that we are discussing this. I had a call with the CEO of a medical device company from California this morning. They create this wearable products which you have to put it on the chest, and then you have the metrics of the blood oxygen levels and everything popping up. The crux of the discussion that went along during our meeting was this. They have currently 75 people managing the billing, and it's a huge number of FTEs involved in this. I asked this question to him, like, Mr. X, haven't you felt outsourcing this particular problem or nearshoring this particular problem to any other group? His response was really aligned with what we are discussing right now. He said to me that, hey, we have outsourced this particular problem. The contract with them was, you do all the collections and then you get a 5% on top of the total collections as the revenue from our side. And it was like a happy path that they had with the outsourcing group, till it came to a point where this person, the CEO, realized that he has no control on the total collections that they are capable of collecting. And they made the right choice of moving from that outsourced vendor to completely make the process insourced. Right now, they have a setup where there is a VP of Revenue Cycle Management, and she is leading all the 75 people that I talked about. And they are interested in bringing in AI and automation to see how much of the work could be incentivized and how much of the processes could be streamlined with a mixture of their own people doing it along with AI doing the rest. Because like you said, Gabe, turnaround time is huge in terms of collections, in terms of cost to collect, in terms of making sure that the cost to collection days is not going up. You have to have a check on the time that you are spending to get the reimbursements from the insurance companies. So I just wanted to share that story based on the discussion I had with the CEO today.
Absolutely. Okay, I'll comment on that. We do have a Q&A piece, Ron. I have one question I want to ask you. Anyways, but the point is, like, think about how cost to collect is calculated. Like, if you're spending, say you're a health provider with 100 million in revenue, and you're spending maybe $6 million on your rev cycle, like operations in total. Like, now you have a 6% cost to collect. That's okay. That's industry average. If you keep trying to throw bodies at a problem, it's not going to get better. You just cannot get any lower than 6-5% ish max. You can do it with technology because you have high performing staff that you empower them to do better work. That lowers your cost because now they can, instead of taking on 10 or 100, they can take on 2, 3, 4x what they're currently doing. So the question I wanted to ask you, Ronald, that we got is basically, how does AI, this is in the prior auth process, how does AI decide when to escalate and when to auto process. And they're probably asking that because usually there's the smooth prior auths is submitting, it's good to go, it's going to be approved within 2 days or right away. Then there's a prior auths that ask for more documentation, and there's the denied ones. But the middle of the group, the middle of the pack, automating more deeply into that's how you get more value from automating prior authorizations. So speak on that if you don't mind.
Yeah, absolutely. No, I think, see, AI agents at the end of the day, they have the reasoning engine behind the scenes, but not necessarily that guarantees that they will have a solution to all the problems. For example, there are certain policy documents which insurance companies comes up with, which is very difficult for even a human to read through and understand what sort of services or what sort of treatments for this particular health plan can be covered by this particular group, which used to be a simple task in the past. So if you have an AI agent encountering the same kind of a problem where it needs to go through a new policy document, and it is not able to understand that the services that you're offering is in adherence to the payer requirements on the new policy or not, it is at that point where AI agent can simply flag those use cases and stack it up in a queue and move it to a prior authorization specialist on the provider side to kind of deal with that situation more sensitively. uh, there are times where, and I think I discussed this very briefly, there are times where AI agent is kind of having some bars or some constraints because the provider groups we work with, they tell us when it comes to clinical judgment, we will still have a human on our side make that phone call to the insurance company instead of an AI agent doing that phone call, because phone calls are the fastest thing that would be intercepted by the insurance plans and they're not going to respond to it. So it's like a switch, they can disconnect it at any point. So how will AI agents kind of come into play in this kind of a scenario? AI agents will help your prior authorization team member to consolidate all the documents, all the medical records, all the medical necessities, and then put it to you for the final review. And at the same time, you being a prior authorization specialist can take that document and have the conversation with the insurance company on the phone, because it is at that point where you would need to make some decisions, which perhaps at this point in the AI journey, we are not there yet, if that makes sense.
Absolutely. So Zia, in a second, I'll let you close out with any final thoughts. I'll tell a quick story. This is from last week, Rana, when we had a kickoff with the client. The VP of revenue cycle, which she could only manage so much. When we were actually looking at the process, when we were actually doing the situation, like the admin individual who does it was showing us the manual process. The VP of revenue cycle said, "I didn't know you were doing all that. I have more respect for your job." And the point is, it's if you have staff that's clicking and typing and doing the data entry and reading through massive amounts of documentation, it's just not the most optimized, practical way to do it. And again, when we were talking about cost to collect, if you shave off even 1% of cost to collect in the example I gave with $100 million in revenue, that's $1 million in additional revenue. It's not just about the money, it's what that can do. You can invest more and more in your staff, and it always trickles back down to physicians and patients to make that process simpler and better. Zia, I don't know if you wanted to actually, close out with any thoughts in terms of how we can, what takeaways we should get from here.
Yeah, I would say I think in the front end processes, right? The referral, intake, prior authorization, specifically prior authorization. I think one of the things that you said, Gabe, was that it even if you're trying to automate it, right? Even if you're working with different vendors to automate it, it is still a highly iterative process, right? You still have because it's a very highly variable environment when it comes to pair rules and all the different types of changes that happen from one specialty to another. So I think one of the things that you have to, when you talk to a vendor, you have to look at, it's you're not just you should not just be looking at it from the, okay, how do I just automate the mechanical part of, just submitting the prior authorization? That's not a big deal. What you have to look at is, you have to look at the vendor from a standpoint of, do they have a solution where they're actually creating the prior authorization request or the package by looking at the payer rules in depth, by looking at the patient chart, and by figuring out, whether a prior authorization request is needed or not needed, and if it's needed, having a comprehensive documentation. It is, and we think that it's an iterative process that you have to go through. So front end is much more difficult to automate, and that's where you have to look at the vendor, where they're actually going deeper into it rather than just cosmetic automation. The back-end processes like payment posting and those type of things, they're a little bit more predictable. But even with that, you need to have the ability to be able to process, read and match the ERAs and the ELBs and those type of things. So look for a vendor, where they have not just where they have the depth in these processes, and not just, they're not just doing the mechanical RPA type of automations. That's why the concept, the concept of AI agents actually goes much more deeper, because we're able to, we strive to automate the process, end to end. And that in many cases is an iterative process. And I think the vendor and the and the providers themselves should understand and adapt to it. So that's kind of like my thought process.
I love it. I can't thank you both enough for the passion and the time spent discussing this. I think whether you're a behavioral health provider, an FQHC, a specialty clinic, the point is you need technology that can reason, and it makes a huge difference for you. So anyone who's interested, we'll share our contact information here. You can reach out on LinkedIn directly to Rano or myself. You can email us directly, and hopefully we can work with you to help you automate a lot more and help your staff out and ultimately help your patients. Thank you all.
Thank you.